Hi friends, my name is BhanuPratap Singh. I am working in Biyani group of college as an assistant professor, and today I want to deliver a lecture on antihypertensive medication. So first of all, we will introduce about the blood pressure. What is the blood pressure? Blood pressure is first of all we will introduce about the blood pressure. Blood pressure is the pressure which is exerted by the blood against the arterial wall when the blood flow through the artery, and the normal value of the blood pressure is 120 by 80 mm of Hg, in which 120 is the systolic blood pressure and 80 is the diastolic blood pressure. And after that we will introduce about the hypertension. What is the hypertension? Hypertension is a condition in which the systolic blood pressure is above the 140 mm of Hg and the diastolic blood pressure is above the 100 mm of Hg. So first of all we will discuss about the antihypertensive medication, and this is the classification of the antihypertensive medication. First of all, diuretic drugs, second one beta blocker drugs, third one angiotensin converting enzyme inhibitor drugs, fourth one vasodilator drugs, and fifth one is calcium channel blocker drugs. So first of all, we will provide to the patient diuretic drugs. Diuretic drugs are the drugs which increase the urine output, and when the urine output increase, it reduce the blood volume and reduce the blood pressure. And the example of the diuretic drugs are the furosemides and lacilactone. So when we provide the diuretic drugs, it reduce the BP by the increased urine output. And the second one antihypertensive drug is the beta blocker drugs. When we provide the beta blocker drugs to the patient, these drugs reduce the effect of sympathetic nervous system on the heart, so the heart rate is reduced and cardiac contractility is also reduced. When the heart rate and cardiac contractility is reduced, it reduces the blood pressure. And the example of the beta blocker drugs are the atenolol and propranolol. And third one angiotensin converting enzyme inhibitor drugs. When we provide angiotensin converting enzyme inhibitor drugs to the patient, these drugs inhibit the renin angiotensin mechanism in our body, and these drugs also block the production of angiotensin II, which is a vasoconstrictor. And when we provide angiotensin converting enzyme inhibitor drugs to the patient, these drugs also reduce the BP. And the example of angiotensin converting enzyme inhibitor drugs are the captopril and benzopril. Next one, fourth one is vasodilator drugs. When we provide the vasodilator drugs to the patient, these drugs dilate the blood vessels, and when the blood vessels dilate, they also reduce the BP. And the example of the vasodilator drugs are the hydralazine and NTG. NTG means nitroglycerin tablet. And last one, calcium channel blocker drugs. When we provide the calcium channel blocker drugs to the patient, these drugs also dilate the blood vessels and reduce the sympathetic nervous system effect on the heart. So these drugs also reduce the heart rate and cardiac contractility. So these drugs also reduce the blood pressure. And the example of calcium channel blocker drugs are the nifedipine and amlodipine. Thanks for watching my video. Like, comment, share, and don't forget to subscribe our YouTube channel and visit our website gurukpo.com.